The spontaneous retropharyngeal hematoma.
Personal data. Name: Jorge Daniel Silva García. Email: iron.dani@hotmail.com. Facebook: Jorge Daniel. Twitter: @danueto. Teacher: Moscoso Escobar John Fernando. Definition: Retropharyngeal hematoma is a real fatal impact given its rapid progression to obstruction of the airway. There are several factors involved in this etiology.
Acute subdural hematomas occur when outside forces, such as the impact from a motor vehicle accident or blunt force trauma, cause the brain to rapidly accelerate and decelerate inside the skull. Movement of the brain stretches the blood vessels that connect the surface of the brain to the dura, the sheet of tissue between the brain and the skull. These blood vessels are known as bridging veins. When a bridging vein is stretched too far, it will rupture, filling the subdural space with blood. This blood is now called a subdural hematoma. The subdural hematoma continues to fill the subdural space based on the rate of bleeding from the ruptured vein. Complications from subdural hematomas arise from increased pressure on the brain tissue, which can eventually lead to tearing of more blood vessels and herniation of the brain.
Application in medicine. Clinically, it may be manifested by neck pain, sore throat, hoarseness, and dyspnea. It describes the clinical triad: subcutaneous, redness, anterior neck and upper thorax, tracheal and esophageal compression, and ventral displacement of the trachea.
Hello, this is Dr. Carlo Oger. Emergency physician and founder of edxitvideo.com. This video is about subdural.
Pro, cons. The monitoring of this patient should be strict and that between 12 to 48 ages when they start alarming symptoms, airway compromising, sometimes require intubation or tracheotomy. The initial medical management should be to maintain the patency of the airways of the patient.
Hey there, medical fans.
Issue applied in Ecuador. The diagnosis of this condition is based on physical examination and imaging studies. As for treatment, this depends on the site of the hematoma and the clinical evolution presented by the patient and may require surgery or expanded evacuator. Simply conduct close clinical follow-up its reabsorption. Conclusion. The initial medical management should be to maintain the patency of the airway of the patient. Retropharyngeal hematoma traumatic cause is a rare clinical entity by the proximity to the upper airway, and it is a space-occupying lesion at the level of the deep layers of the neck. It can produce quick installation of an acute obstructive respiratory failure.